The final section of the town hall addresses creative and innovative ways to retain, as well as to attract SLPs in the school setting. First, let me give you a bit of background. The ASHA School Services team held the first virtual town hall. This is the second. They held the first, and the panel there addressed concerns about impact, retention, including diminishing school funding and accompanying personnel shortages, high caseloads, excessive paperwork and documentation, limited ability to vary their service delivery models. You can view the 2018 Town Hall recording on the ASHA website. There are many reasons for us to work now in the areas of retaining. Launched in 2015, ASHA's Value of the Seas advertising campaign promotes the value and the training of ASHA certified members. In its outreach, school-based SLPs received enhanced promotion. Campaign ads about school-based SLPs have drawn more interest than any other ads of this highly attractive campaign. In order to support school-based SLPs with workload, caseload issues, and ultimately promote retention, the school services team developed the ASHA Workload Calculator. Many of you are familiar with it. This tool allows school-based SLPs to document the time they spend on various components of workload, including provision of direct and indirect services, case management responsibilities, preparing for and attending IEP meetings, and other activities. This is a free tool and covers all of these major concerns. How do I spend my time as an SLP? The most exciting features of the calculator are the two visualizations that it provides, and you see them here on that handout. The calculator provides insights into factors that might impact an individual's SLP workload, such as the intensity of the student needs, involvement in meetings and school district-wide initiatives, and, of course, service delivery factors. This tool provides a beginning point for dialogue with decision makers, including supervisors, administrators, and special education directors. Now you have a look at the Performance Assessment of Contributions and Effectiveness, PACE for SLPs. This value-added assessment tool ensures that school-based SLPs are accurately evaluated according to the unique roles they plan in facilitating communication performance and overall success in the school community. The PACE helps administrators understand the importance of speech-language services, which of course impacts retention. Let's take a look at the next one. ASLP, I see, Audiology and Speech-Language Pathologists in an Interstate Compact. Perhaps you've heard about this. For SLPs who live on the border and work in 2 or 3 states, or SLPs engaged in telepractice, obtaining multiple state licenses can be challenging and costly. The Audiology and Speech-Language Pathology Interstate Compact assists with the facilitation of interstate practice of audiology and speech-language pathology while maintaining public protection. Currently, ASLP IC legislation is being drafted in several states, with many other states considering introduction in 2020. ASHA is meeting with state speech-language hearing associations to help them prepare the Interstate Compact. Now let's take a look at salary supplement. Some of you might not be aware of these comparisons. The ASHA webpage, Advocacy Resource Guide for the Salary Supplement Initiative, includes resources that SLPs can use to negotiate an annual salary bonus for national certification and state-licensed SLP. It's time to listen to another ASHA member and her experiences. This is Julie Malone. Julie is sharing her success in negotiating higher salaries starting salaries for SLPs in her California school district. Julie.
Hello, my name's Julie Malone. I'm a public school SLP in La Mesa, Spring Valley, California. I am a member of the ASHA School Finance Committee as well as the 616 Coordinating Committee. In 2008, I attended the California Speech Language Hearing Association's annual convention to hear Pamela Greenlaw, an SLP in Anaheim, speak on advocacy. At that time, she was a state council delegate for the California Teachers Association, and she was my inspiration to get more involved in my union, first as a support services rep, then joining our negotiations team, and eventually becoming vice president in 2018. Like many other districts, we were struggling to recruit SLPs. Our union successfully negotiated to start new SLPs at year 10 on the salary schedule. So instead of year 1 pay at $57,506, they received nearly $74,000, so a difference of $16,461 for a CF due to our efforts. This has also helped us retain SLPs, making us more competitive financially with other districts in our area. Additionally, we also continue to work on SLP working conditions and now get 20 hours of clerical support per year to help. These are the types of changes that can happen when SLPs get involved with their union and advocate for our profession. It would be incredible to see more SLPs get involved in advocacy, as no one knows the work and issues of SLPs better than an SLP.
Thank you for that information, Julie, and it is time for questions again. First, I'm going to address the questions to our panel, and then I'll be adding the ones that you are sending in. What are some ways that your school districts have done things differently to attract and retain SLPs? We'll start with Janine. What have you done differently to attract and retain SLPs?
Well, it's well documented that regardless of organization, strong leadership is important to attract and to retain, and schools are not immune to that. When we speak to SLPs throughout the country, and even when we were talking as a panel, we all acknowledged the importance of having administrative representation at the school district level and the idea of a lead SLP. Globally, by having a lead SLP, they can serve as an advocate for us as SLPs at the district level. They can be a liaison at the district level across the numerous departments and across schools and grade levels. They can also be a repository for current and accurate information regarding state and federal regulations, including Medicaid. And then they can provide support to SLPs at the school level, being somebody there as a consultant to help them navigate difficult cases or interactions, or even to connect SLPs throughout a school district who may be able to learn from each other.
Thank you. Gerald, would you like to add something to that?
Sure, I'd be happy to. I think Jonine brings up great points about the leadership. You can't speak highly enough of having someone that's going to advocate for the special skills that you bring to a district as a speech language pathologist. So serving as a lead SLP in the past as well, that was something that was big for me. It was also important for me to acknowledge the special skills of the team that I was cultivating. What did you bring to the table? So as we're thinking about filling positions and knowing that we have a student need, we didn't just put a person at a school just for the sake of filling the position. We really interviewed and really talked to that person to find out what their strengths were, what they were interested in, and tried to match and create positions around that. I was fortunate to come into a district where this structure was in place and just kind of build upon it. So for example, someone would come to us and say, you know, I've really been working with students with autism, and I have enjoyed, that process. So we would try to match them to fit them on our district's autism assessment team, and then also find one of our campuses that had a larger autism caseload and would match them with that. So we could fit their interests as well as a district need. Someone would come to us with AAC, our assistive technology expertise. We would plop them right in on our assistive technology team and say, hey, go for it. Let's make this happen. For our new SLPs coming into us, whether that was new to the profession or new to our district, we would provide them with a district mentor. So we would allow them to come in, because whether you have 15 years or 15 minutes of experience, walking into a new situation can be a bit jarring, and you need some support, someone to guide you through those nuances. And so that was something that we found to be very important and very effective. We also broke up our district into regional clusters. So we had a north area, a central area, and a southern area. And we called them clusters. They would have meetings as often as they need to. So the groups in those areas, we also would assign a cluster lead. So there was someone in that area that you can go to for support, but the group also acted as internal support for each other. So commiserating about difficult cases, sharing workload experiences. I have 5 evaluations. Can someone help me cover one? I can cover a group for you. Those kinds of things. And it led to some rich discussions. It also promoted a sense of leadership amongst our SLPs because they would get elected by their peer group. And then those for our 3 or 4 leads, because we also had a bilingual cluster, I forgot to mention that, would meet with me as the lead SLP to talk about issues going on amongst the group and how we could go about resolving that and how we can go about acknowledging those concerns. So creating those opportunities for leadership and moving through, creating mentorship opportunities, allowing for supervision of SLP assistants was also a big thing, but just also creating a community of professionals that could share ideas, expertise, and be able to be collaborative. And it's something that does not always happen. Sometimes we find ourselves in our rooms by ourselves doing our job and not being able to share our ideas or our thoughts with other SLPs. And I think that it was important to build a sense of community. And I think that that's something that anyone in any district can start to do.
Again, thank you. Jeff, tell us what you tried in one school district in Arizona, was it?
Yeah, Arizona. Well, we've already heard some great ideas, and so thank you for those that have already been shared. One of the things that we've tried in our school district, of course, being an SLP, we all know about evidence-based practice. And so when I try to approach this issue of recruiting and retaining SLPs, I looked at it from an evidence-based practice perspective. I looked at the research, what is out there, what do we have in the ASHA Schools Survey and other resources that are available. I looked at what we have experienced in the past as a school district, and then probably most important, I looked at our SLPs and I asked them what their preference was. What are the things that they're interested in and what do they want out of our school district for job satisfaction and to feel that they're appreciated. So some of the things that we came up with are also related to those that have already been said, that often it doesn't take a lot of money to help meet some of these needs. And one of the things that really stood out to me is having a dedicated space. Then you have a desk somewhere, that you have a home base, and you can be part of that community, you can be part of that department. We've also implemented a 3-to-1 model to help our SLPs better manage their time so that they are not constantly dropping everything to go to meetings, that they're able to get their work done, get the treatment done, and then have that reserved time for meeting and evaluations. We've also given them a budget, now that is a tangible, of about $1,000 each that allows them to participate in continuing education and purchase supplies, whatever their preference might be. As we all know, that varies from year to year and day to day, but we give them that option and that opportunity. And we also really have looked at our evaluation instrument. And that was a big one for me coming into the position as a speech pathologist, is that our district was using an evaluation instrument for special education teachers. And we all know that what SLPs do in schools is not the same as what a special education teacher does when they're teaching a classroom full of kids. And so we were able to we didn't adopt the PACE 100%, but we were able to pull out some of the competencies and include that in our existing instrument. And now we have a unique evaluation tool that we use with our speech pathologists. And of course, at the end of the year when they're being evaluated, they feel like it's a legitimate evaluation now because we're looking at them and what their role is in our school district. And perhaps the most difficult thing that we accomplished, took about 3 years, it was not an easy fix, was to establish a separate salary schedule for our speech pathologists. At the time I entered the school district, they were on the teacher scale, as they were with the evaluation instrument. And I immediately approached the superintendent and told him we needed a separate scale, and was told no, and no big surprise there. But what I did notice is that our teachers received a stipend to be nationally board certified. So that's where I started. I convinced the superintendent that our Cs were the equivalent of being board certified, and we were able to receive a stipend. And then over a period of years, we were eventually able to move into our own salary schedule. And so I encourage everyone, if you're in that position, don't give up. Keep advocating. It does take time, but you can get there.
Good stories. Thank you. Our next questions can be answered by John. We've been waiting to hear from you, John. Why should an SLP choose to work in a school setting? What do people across the country value in their school setting?
Thank you, Judy. I appreciate that. Before I dig deep into this, I just want to reference, the Elementary Secondary Education Act gets reauthorized, and the last time it was reauthorized was about 4 years ago tonight, and it is known as the Every Student Succeeds Act. And I point that out because when it talks about stakeholders in a school community, they specifically spelled them out. And one of the terms that was in there that I'm very proud of from our organization and the coalition working with ASHA is the term SISP, S-I-S-P. It stands for Specialized Instructional Support Personnel. We all know that SISP bring additional skills and expertise that's needed by all children and all students in the schoolhouse. So other SISP include school psychologists, school nurses, school counselors, occupational therapists, physical therapists, et cetera. But I just wanted to make sure everyone is using that term and that you're specifically identified in the federal law of ASHA as a specialized instructional support personnel. One of the things I hear most often from SLPs is that they like about working in the schoolhouse is if they are parents or guardians of young people, that they have the school calendar. And that's very advantageous to them, in terms of even saving money, in terms of child care supports or anything like that. The other thing, besides the obvious negotiating salaries and working conditions, also would be the benefits of health, vision, and in most cases, a pension that they could enjoy later on. So that's one of the most obvious things, and I want to give a shout out to ASHA and the folks that have referenced this caseload workload portal that you have. It's fantastic. It is something we are pushing also in conjunction with you at ASHA, because this is something that needs to get into the hands of local school districts, the people that are opinion makers, policy makers there, local school boards. And a lot of times, SLPs don't know where to start with that conversation. If you visit myschoolmyvoice.nea.org, we have a conversation starter for you, and it's a checklist of what effective schools look like. And we all know the tremendous impact that SLPs have in terms of students developing their reading skills and language development and the evidence-based practices that the other panelists have referenced. We're also trying to get this into the hands of those of you that are in bargaining states, to the bargaining teams. And I would encourage, as others have said, and Jolie in the video, step up to speak up. One of the things I'm most proud of when I was an educator leader in Western Maryland, I invited speech-language pathologists to be a part of the bargaining team. And it was a real eye-opener for everyone. I think most especially our Board of Education. Too many times, these professionals were seen as itinerant. It was a rural area and not necessarily part of the school team. And one of the things became very clear to me, because you're often involved in the IEP process and students with disabilities, you're asked to work outside of the contract. And in our case, it was the SLPs were on the teacher contract. Because, for instance, if you're asked to do an assessment in July, you should be compensated at the same rate when you conduct that assessment in March of that school year. we were able to get that language to have their pay be commensurate with that, and also have it count toward their pension. It wasn't just an hourly stipend thing that occurred. I'm very proud of that, because what came out of it also was the group of SLPs started to meet monthly, and they always had someone that attended the Board of Ed or had a designee that would, and then at their monthly meetings, they would share out. And they really became quite a well-respected and much-needed force that needed to be at the local school board. The other thing that I wanted to mention that I think is a great benefit of being in a school environment is the ability of our SLPs to collaborate. You're often the first line ambassador to the school system. Those of you working with Child Find, and when they start speech services at age 3, they might be meeting at the schoolhouse, and that SLP becomes the ambassador to really open that gateway to what we want to be a positive 12-year K-12 experience. Also, the collaboration that you can do with school staff members. Too often they feel that it's a disconnect, and there shouldn't be. And also too often we only associate these services with students who have an individualized education program. The skills that you offer and other SISP are skills that are good for all students, just like a PBIS, when it's implemented with rigor and fidelity, all students benefit from that. The other piece that the collaboration comes into hand is with the community. If you're in a rural area especially, you may be teaming up with a local health department to provide services or work with a social worker. And that can be a key collaboration. And also with administrators. As I said, a lot of times SLPs don't know where to start that conversation, and they really don't have a clear understanding of your expertise and the work that you delivered. And they're often using a teacher evaluation as a tool on a speech-language pathologist, and we all know in this room and on the town meeting, they're very different skills and expertise. So again, I encourage you to visit the site for that checklist, and I think we're going to be able to make it available on the recorded version of this and have the link. But the other thing I want to touch on quickly that we can provide through the association are professional development opportunities. A lot of times people don't look to us or think of us necessarily as folks that provide training. One of the hats I wear at NEA is with our IDEA cadre. We provide facilitators training, and then they go out and provide the training in your school districts. And it might be on IDEA itself. One of the most requested things we get is addressing behavior challenges. That's real if you're in a classroom. That's real if you're working in small groups with students. We also provide trainings on social justice for our LGBTQ community and students, and we provide trainings on racial justice in implicit bias. So I wanted you all to be aware of that. We also can provide professional development training to you where you can become micro-credentialed in certain topics of your interest. So we're trying to get away from the one-size-fits-all, and that you can choose the professional development that is relevant and meaningful to you, excuse me. I already touched on the negotiating team example in my local, but from that, I wanted you to know that we provide advocacy training, and I really like how folks have tied that in with the panel here and on the video. Either through campaigns or elections or Strong Schools 2020, let's face it, everything is political when it comes to the schoolhouse. Our schools are as safe as the communities they sit in. Pay scale is negotiated, or elected or school board officials do that. So never feel like you shouldn't be an activist, because in reality, everything is political. And as someone said earlier, just stick with it and keep going back to doing what's right. And when we do what's right by students, our communities agree. And I think that was highlighted last spring when we saw Red for Ed movements all around the country. And they were going out on the streets because, they had leaking roofs or didn't have the resources that they need in terms of computers or labs, or maybe they don't have a speech language pathologist there. Maybe they only have a school nurse 1 day a week or half a day. When we make it about students, which is what we do, and I want you to know that, the NEA is able to provide these professional development and leadership trainings for you. So I encourage you to visit our site. And I think my time might be up, so I thank you for yours. Okay.
Thanks very much, John. We really appreciate it. We're going on to our next question. It's about telepractice and use of speech-language pathology assistants. I'll ask Janine to start, and then Gerald will enter into it. How have telepractice and use of speech-language pathology assistants helped some districts attract or retain school-based SLPs?
So let's just begin with telepractice is the use of telecommunications to connect an SLP with a child, and that's typically done via video conferencing. And there's many ways that telepractice is being used to attract and retain. The most obvious is to fill open positions. We see school districts across the United States turning to telepractice as a viable model, school districts in both rural and urban areas. A second way that telepractice is being used, it's being used by East Coast school-based SLPs as a mechanism to supplement their incomes by delivering services to children on the West Coast in school districts. So they're able to capitalize on their school-based skills, earn additional income, and meet the needs of school districts on the West Coast. A third way telepractice is being able to retain is it's being viewed by seasoned SLPs who are seeking opportunities to reinvent themselves, and they're turning to telepractice as a way to challenge and stretch their skill sets while still working with children in a school setting. We're also seeing school districts themselves starting to investigate innovative ways to use telepractice. We're seeing them look at it as a way to alleviate travel time of itinerant SLPs or for SLPs who service homebound students. We're also seeing them look at it as a way to capitalize on the expertise of SLPs. For example, a group of SLPs in Dallas School District are looking at it as a way to take their board certification in fluency and be able to use that with all children in that very large school district who could benefit from their services. It's also a way to connect through consultation. Maybe an SLP with expertise in deaf and hard of hearing could consult, model, and guide an SLP who is working with a child with a hearing loss. And then finally, we are seeing it as a tool to recruit supervising SLPs in school districts. We are finding many of our supervisors are interested in learning about telepractice, and so they accept our students who are in the grant so they can learn more about not just telepractice, but how to use technology in a meaningful way beyond just for reinforcement. And then to end it, and I'll turn it over to Gerald, is our students are highly interested in learning about telepractice. They do see a place for it in our service delivery continuum and know that they need it as part of their skill repertoire.
Thank you. Before you begin, Gerald, we have numerous questions now coming up in our last part, but I invite you to add your comments now, and then we have questions for literally everyone here.
Okay, so thanks for sharing about telepractice. I think it's important. I think we find it happening in every allied health profession that exists, and why not jump on doing those things effectively? But just kind of answer your question about how do we work with SLP assistants in the schools? Well, first of all, we have to acknowledge them as a highly specialized professional, right? And what they have to offer to us to provide the services for our students. from my perspective, I've been able to work with some very talented SLP assistants, and they've helped me to continue to provide a continuum of care or continuity of care in those situations where I may not be readily available. So how many of us have to get pulled away for referral meetings? How many of us are getting pulled away for IEP meetings, parent drop-ins, any number of things that can happen in our school day that takes us away from our direct care. So having that professional that's there on the side of you that I consider to be a professional extension, because we're working collaboratively, can continue to make sure that our students are getting the best services, which then will increase the outcomes for productivity and increasing their communication skills. But then also we want to acknowledge the fact that being a mentor or a supervisor stretches your skill set, right? It allows you to grow some leadership skills, collaborate with other professionals, allowing for mentorship, and just really improving clinical skills needed for instructing teachers, families, and others. So I think it's vital. And I'm happy to see ASHA moving towards certifying assistants at the national level. And I think that's just going to provide more validity to the work that assistants do for us.
Thank you. I'm now going to invite Lori to begin to talk on her last question here from the panel, followed by Chuck, who also has some things to add for that, and then I believe Kathy will as well. I will have to kind of restrict you to about a minute for each of you. What do I do when my supervisor does not respect the district or state policy about caseload maximum and says I have to provide services as the district does not have the money to hire more staff? Help us out, Lori.
Well, that's a great question. I want to first just really quickly say that OSEP's priority around the track, prepare, and retain is around retention, because we feel that this is the area that we can impact right now. And so when we take a look at the SLPs around workload and caseload, I do want to also let you know that OSEP has a very high priority to raise the expectations for our students with disabilities, but also to improve results. And I believe that one way that we are able to improve results for students with disabilities is to look at the workload issue. But I'd like to emphasize the importance of the data and the student performance data, and use that as your lever in your conversation with your administration around your workload responsibilities, and that we have to make sure that we are messaging the importance of the I in IEP, and that's the individualized, specially designed instruction that our students with disabilities really deserve and are entitled to have. So using the student level performance data to be able to message with your administrators the importance of having the time flexibility to be able to meet those unique and individual needs of the student, I think is going to make a difference for you.
Thank you very much. Chuck.
Yeah, building off of that, I'm going into the discussions with the mantra, do what's best for kids. The directors want to do what's best for kids. And so going in and talking about the impact of your workload as it relates to FAPE, and even LRE, I think is an important lens to help them see. Shying away from going in and talking to someone who's very busy and letting them know that you're also very busy doesn't seem to be as effective as coming at it from a student outcome perspective. I think also realizing too that not every solution is a staffing solution. Not every solution is going to be hiring an additional SLP, because there may legitimately not be an ability to hire someone. And so looking and seeing if there are any kind of workload reducing strategies that can be done. There was mention of clerical support. We've had a lot of success with that in Ohio. Redistributing workload. The nurses in Ohio were able to do hearing screening, so instead of the SLPs doing it, we've passed that over to them. Parent volunteers. My wife was a school-based SLP, and she would work with the Parent Volunteer Association to do some clerical stuff, Velcro, laminating, coloring, binding. And she had a lot of success with that. And she worked with a lot of multi-handicapped students, and so there was a lot of that crafting kind of thing that needed to be done, and the parents were very excited to help. Also, getting high school students down. High school students need to get community hours, and so they can be the ones that maybe could do auditory bombardment with some of your phonology students, maybe doing some of your grammar drill, as well as some of the lesson prep that can be done. And then also collaborating with local universities to get undergraduate students to come in and volunteer. They're dying for volunteer opportunities. And so really looking at your workload, not just as necessarily hiring someone new, but is there an opportunity for me to say, can I not do bus duty anymore so I can use my master's degree to test a kid? Can I not do cafeteria duty so I can attend an IEP meeting?
Thank you very much. We were now going to hear from Kathy. Please.
Thank you. When I hear that our school does not have the funding for the positions, that is something I hear often in Arizona, and I imagine in many other states this is also an issue of funding, of state funding, of federal funding. And so we need to be advocates to have our schools be adequately funded, to make sure at both the federal level, federal and state level, that we are adequately funding our schools. And then even within our states, making sure that that funding formula is equitable to make sure that all students have access to a high quality education. And when I think about the funding needs for our schools, I don't just mean the pay, while pay is very important. I'm also thinking about the cost of healthcare, or is there affordable housing for our educators? Or what about paid family leave, like having paid maternity or paternity leave? And then also, what is the access to childcare near that school? Can the school provide childcare for the educators, for the SLP, or for the teachers? So it's a complex issue when we're talking about funding and school finance, but I think that that's one area where we can be advocates, and that can also help to improve our caseload and workloads by making sure we have adequate funding.
Thank you. I have questions now from the audience. Many of us feel we were not well informed about the heavy burden of paperwork associated with our job. Each year it seems more paperwork is added. How can students be trained and prepared to handle this burden? In 15 seconds or less.
I'll take it, Judy.
Okay.
So I have found in working with graduate students that we do need to expose them to the realities of working in a school system. It's not just limited to speech pathology, it's in special education as well. We often hire teachers who have never written an IEP and really don't know what it's all about, but yet they have a degree in special education. Same thing is true in speech pathology. In our programs, we just need to remember that 50% of our graduates are going to the schools, and we need to make that part of our curriculum.
And now we have to leave these for another day. They're good questions, and we had fabulous time with our speakers today. Please thank them. And I will wrap things up for us. It was a very interesting discussion on, of course, words that will now ring true for us a long time, and that is to think about our ability to attract and prepare and retain individuals in our field. Here's our ASHA Schools team. Thank you very much for all they put together for this wonderful program today, and I'm very pleased to have been part of it. One more time, thanks to everybody who was a big part of this. You know the information for CE credits, and thank you all. Good night.